Hello, good morning everyone. My name is Jose Isa, as you know me. And today I'm gonna show you this exercise related with the Gynaecology chapter 21 from the Professional English in Use Medicine book. Okay, let's begin with the exercise 21.1 says, the mandatory says, write a simple English phrase for each of the medical terms below using your medical knowledge. Look at B and A opposite to help you. Ok, dice acá que escriba un ejemplo simple o una frase que describa los términos que están abajo usando sus conocimientos médicos. Mira la opción A y B que están para ayudarte. Number 1 is hysterectomy. Hysterectomy. Eso es histerectomía, una histerectomía. That's mean in English, surgical removal of the womb. Surgical removal of the womb. O sea, una cirugía donde se remueve, donde se hace una extirpación de la matriz. Surgical removal of the womb. Extirpación de la matriz. Next is menorrhea. Menorrhea. Menorrhea, yeah. Menorrhea. That is in English heavy periods. In Spanish, o sea, periodos en abundancia. Heavy periods. Next is salpingitis. Salpingitis is related to the inflammation of one of the tubes that connect the ovary to the womb. O sea, es una inflamación de uno de los tubos que conecta el ovario con la matriz, con el útero. Excuse me. Next is cervical biopsy. Cervical biopsy is a biopsy of a small of tissue removed from the neck of the womb. O sea, es una pieza o una pequeña pieza del tejido que se extrae del cuello uterino. O sea, del cuello uterino, de la parte del tejido se remueve lo que es un pedazo para analizarlo. Entonces, cuando se van a hacer tipo de biopsias de análisis. Okay, next is read the conversation between the gynecologist and the patient in C opposite and complete the notes about the patient. Okay, that's meaning in Spanish, lee la conversación entre el ginecólogo y el paciente. En la opción C dice acá que no. En la opción C, que está para ayudarte, y completa las notas de cada paciente. Con esa completa las notas sobre el paciente. Next, number 1 is menarche. Menarche is around since the 12 years ago. No, since the 12th year. That is when the menstrual bleeding starts. O sea, cuando el sangrado vaginal en las mujeres en el periodo menstrual comienza a la edad de los 12 años. Okay, next is menstrual cycle. Menstrual cycle is since to the 4th week to 5 week divide 28. O sea, desde la cuarta semana vas a la quinta y en un periodo de 28 semanas. Next is LMP, last menstrual period. O sea, Last menstrual period, eso es el último periodo menstrual. That is related to the answer is 1 divided 52 ago. And next is menorrhea. The patient said no. Menorrhea, no. Patient said heavy. That is related. Menorrhea is related with heavy or prolonged menstrual bleeding. O sea, un sangrado menstrual abundante o prolongado. It could be too. Next, dysmenorrhea. That is related to the painful menstruation, typically involving abdominal cramps. O sea, eso es cuando ocurren calambres vaginales en las mujeres cuando están en el periodo menstrual. Eso quiere decir, la paciente dijo, patient said no. Next, discharge. Discharge, eso es cuando las mujeres ya comienzan a eyacular durante el periodo menstrual. Discharge is the answer patient is a little white discharge, o sea, una pequeña secreción blanca. Next is exercise 21.3 says, now write the questions that the doctor asked. Look at C opposite to healthy. Menarche is number 1. Menarche. How old were you when how old were you when you start to get your periods? O sea, ¿qué edad tenías o a qué edad te comenzó cuando tú comenzaste a tener los primeros periodos? Next is menstrual cycle. Ciclos menstruales. The answer about this is, are your periods regular? O sea, ¿son sus periodos regulares? How long do the periods last usually? O sea, ¿qué tanto duran sus periodos usualmente? Y son sus periodos regulares. Next, LMP. When was your last period? O sea, ¿cuándo fue su último periodo? Next, menorrhea. Will you say they are light or heavy? O sea, son ligeros o son pesados. Will you say they are light or heavy? Next, do you get clots? O sea, tienes coágulos durante el periodo. Next, dysmenorrhea. Do you get period pains? O sea, tienes dolores durante el periodo. Discharge. Patient said, is there any discharge between the periods? What color is it? The doctor asks. Is there any discharge between the periods? What color is it? Patient said, it's white. Before. Okay, next, complete exercise 21.4 says. Let me down the page first. Okay, here. Case 15 says, a 45 years old woman had been having prolonged heavy periods lasting for 8 days with the passage clause for 9 months. There was no bleeding between periods or after intercourse. Periods were not particularly painful she had noticed any hot flushes or night sweats, and her general health had always been good. She had taken the oral contraceptive pills until a year previously, when a copper coil was fit. She had had a normal pregnancy when she was 25. Ok, dice acá que una mujer de 45 años de edad había estado teniendo periodos prolongados y abundantes de 8 días de duración, con expulsión de coágulos durante 9 meses, no hubo sangrado entre los periodos después del coito. Sus periodos no eran particularmente dolorosos. Ella había notado sofoque y sudores nocturnos, y su salud generalmente siempre había sido buena. Había tomado píldoras, que son pastillas anticonceptivas orales, hasta un año antes, cuando se le colocó una bobina de cobre. Ella había tenido un embarazo normal cuando ella tenía 25. Okay, here in this case, no es una bobina de cobre en sí, sino el contraceptivo. That is the meaning about this. Okay, next we have to do this, that is diaphragm. Next is IUD, condoms, and copper coil. O sea, esos son tipos de anticonceptivos que se utilizan acá, que se utilizan regularmente, excuse me. Here in Dominican Republic, that is the over to you. Let's begin after that. Okay, next, then the first one is a very method contraception, that is diaphragm. O sea, es un tipo de método de contraceptivo. Next, it is a small device that is placed in the uterus to prevent pregnancy. O sea, es para evitar que la mujer quede embarazada. Eso es un pequeño anticonceptivo. Ese es el IUD. Okay, next, the over to you. Let's go. Over to you says, what is the attitude to contraception in your country? At what age do you think females should be prescribed contraceptive? O sea, acá dice que cuáles son los anticonceptivos que se utilizan regularmente en tu país, en mi país, in my country. As you know, I'm Dominican Republic. Here in Dominican Republic is most commonly, is most commonly the condoms. Los condones aquí mayormente son muy utilizados. Copper coil, it could be too. I hear that before. So that I'm not sure, because I only hear. So next is diaphragm and IUD. It could be, but it's not commonly. Okay. At what age do you think females should be prescribed contraceptive person? After 25 can be used, because is more complicated if you use that before age. You have to development first your health, and then you can use that. But if not, if you are pregnancy, a middle name, a middle age, it could be a risk after that. Okay, people, I hope this video like. I hope you can practice with this unit and have a good day. My pleasure.